The world today is not the same world we once had back in 2019. COVID-19 has changed all of our lives completely. COVID has caused much anguish and pain to families, especially those who have lost a loved one. There are many different ways communities can help to prevent the spread of COVID. One way is wearing a mask in public. The importance of masking in public has brought upon a division in our communities. Some people mask and some people choose not to. But what are the facts when it comes to masking in public? According to Brooks and Butler, first, masks prevent infected persons from exposing others to SARS-CoV-2, which is COVID-19, by blocking exhalation of virus-containing droplets into the air. This aspect of mask wearing is especially important because it is estimated that at least 50% or more of transmissions are from persons who never develop symptoms or those who are in the pre-symptomatic phase of COVID-19 illness. In recent laboratory experiments, multi-layer cloth masks were more effective than single-layer masks, blocking as much as 50% to 70% of exhaled small droplets and particles. In some cases, cloth masks have performed, similar to surgical or procedure masks for secure control. Second, masks protect uninfected wearers. Masks form a barrier to large respiratory droplets that could land on exposed mucous membranes of the eye, nose, and mouth. Masks can also partially filter out small droplets and particles from inhaled air. Masking helps prevent the spread of COVID from everyone, especially those who are immunocompromised. Unfortunately, masking can help keep COVID numbers down, but COVID is here to stay, just like the flu. Social distancing has become a big help in preventing the spread of COVID. What is social distancing? According to Zhao et al., social distancing, also called physical distancing, means keeping a safe space at least 6 feet away between yourself and other people who are not your household, especially individuals with unknown infection status. Although wearing a mask is the best way to prevent the spread of COVID, social distancing is important to reduce the spread as well. During the beginning of the pandemic, many businesses were closed to reduce the spread of COVID. Sports games were not allowing fans to sit in on the games due to it being impossible to social distance in the stadiums. Unfortunately, not everyone is able to social distance, especially us in the healthcare field dealing with direct patient care. This is why masking is important for those who work in an environment where they cannot socially distance, no matter what. Hand washing has become a major topic during the COVID pandemic as well. According to Hawk, hands generally remain dirty and contain pathogenic microbes. Microbes generally Enterococcus and Enterobacter, possibly from fecal source, were isolated in 44% without hand wash samples. People often touch their eyes, nose, and mouth, but are not aware of the harms of such acts. Microbes are transferred from hands to eyes, nose, and mouths, thereby get into the system to develop infectious diseases. The best way to avoid transmission of germs is to wash your hands with soap and warm water for 20 seconds or sing the happy birthday song. People are constantly touching their mouth, eyes, nose without even noticing. That is why it's important to wash your hands. Even as healthcare individuals, it's important that we wash our hands once we go inside patient rooms and once we come out patient rooms as well, just so we can keep down the transfer of these infectious diseases. COVID is a major dilemma we are dealing with today. It is our responsibility to ensure we take preventative measures to help prevent the spread of COVID. As healthcare workers, it is important for us to educate those who do not have much information about COVID or those who believe it does not exist. It is important for us, as well as healthcare individuals, to educate people outside of our communities as well, and just educate them on the importance of how to decrease the spread of COVID and why it is important, and just give them the facts of how this disease has hurt many families and killed many people in a short amount of time. COVID started around, well, here in the United States, it came around March 2020, and a lot of people have passed away due to negligence of other people not caring about the vaccine or not caring about the pandemic, thinking it doesn't exist. But it's important for us to make sure that we take care of our elderly and young children and make sure that they are protected. But sometimes that can't happen, and sometimes we do protect them, but COVID just happens to just catch on, and they end up getting it anyways, even though people have been so uh, diligent in keeping their hands clean and doing everything possible to prevent the spread of COVID. Sometimes people just end up getting it anyways, which is upsetting. Thank you for taking the time of watching our COVID presentation, and please watch and show and spread to other family and friends. Thank you so much for watching this health fair, our virtual health fair. Thank you.